So basically, I was charged with talking about tips for navigating unproven treatment option, and I don't think that's the best name for this. It's more, how do we make good decisions about your care? And I think that's probably a better idea. We want part of what we do as physicians is have a relationship with our patients, and we want to guide our patients to be in a position to make the best decisions for themselves. I have no financial disclosures, but I'm not as funny as I think I am. So part of this, and I think you've already spoken to everybody, everybody's kind of leaned on this idea, is you really need a team. And I'm from Miami, and we, I feel like, have one of the best in the country. So I just want to recognize part of my team. That's Janine. She was here. She's way in the back. Michelle, who's in one of the other rooms talking. Dr. Schuffelbarger, who is probably the mentor to a lot of people here, and is my senior partner and a good friend. He's not here today. And Dr. George. So he's too tall, so we cut the top of his head off. But the idea of having a team, having the people around you who can interact with you guys and kind of point out to us when we're not doing what we need to be doing to convey the messages to you well. So the purpose of my talk is not to debate the science. I think we've already heard kind of all the talks on the science. It's not to recommend one treatment over another, nor is it to tell you what to do, but it's to give you the common sense rules to help you make good and appropriate decisions for yourself and optimize your outcome, not only in the short term, but in the long term. And so these are my common sense dummy rules, right? And they work quite well. And so what is empowerment? That's an important initial question. It's to understand, it's for patients to understand their health condition and its effects on their body. You also want them to be able to feel like or you guys to feel like you participate in their care. And you want to be informed about your choices. So the question that you had about why nobody's spoken to you, initially you had to do all this background research about Schroth and alternative treatments, right, on your own going to the internet. That's something where you weren't empowered in that situation. And that's kind of the issue right now. There's a lot of stuff out there. It's growing quickly. How do we put you in a position where you guys feel like you are making the best decisions? Because ultimately the decision lies in your hands. We're there to teach you, we're there to help you, but the decision lies in your hands. So the rules only work if we trust one another, right? If I trust you and you trust me. And we always think of it as the patient trusting the doctor, but it's the other way around too. And that's a lot of times when we have things out there that are non-traditional or really new, it's actually the doctor needs to trust the patient to be able to have that conversation with them, right? Because they're going to go outside, and especially with the way information is available nowadays, they're going to go outside and they're going to look it up regardless. And if if there isn't a comfort level between you guys to speak, then that's going to be a problem. And these rules only work if you can communicate. So too often families are afraid to have legitimate discussions on information that they get from Google, other families, discussion forums, Facebook, the internet. And I'm not being a good doctor if you're not comfortable having that talk with me. So here are my rules, right? Number one, do no harm, right? And that is different in every context, right? So in the surgical context, this very scary looking thing on the right, that's a very different sense than what we're talking about here. And in the bracing context, in the patient that may not necessarily be a candidate for surgery, we're trying to prevent progression, do no harm, maybe the idea of bracing and Schroth, or maybe something very different, but the context changes, depends on the situation. Number two, don't spend your child's college tuitions on treatment modalities. The kids are expensive, that's given. But I've had people who spend several tens of thousands, or come to my office with this need to spend several tens of thousands of dollars to provide treatment for the kid. And usually, if you sit and you discuss this with them and you figure out ways to kind of meet them halfway, you are able to do this. I don't, like too often, especially in my population, we'll stick with my population in Miami, I have a fairly middle class, lower middle class populations. Some of them can't afford to fly to New Jersey. Some of them can't afford to fly to and so what treatment options do they have? What is available to them locally? And we have to specify to that need, because, you know, if you are sacrificing your child's future in a number of ways, if you're, we got the scoliosis part treated, but now, you know, the family's eating ramen noodles, or, you know, like that's a big problem as well. So, and at the same time, if somebody is selling you this idea as this panacea, I would highly doubt their information, right? I mean, like you saw it on Dr. Pace's thing. This is like some of that information. It's how it's presented, right? It's not a matter of whether it's true or not. I could sell you anything. I could go out and tell you that the sky right now, it is raining outside, and if I present it well enough, you will believe that, right? So it's all a matter of perspective, and that's why we have to be kind of dubious sometimes of where the information comes from, and we have to be cognizant of each individual family and what their needs are. Okay, let me be the judge of your treatment efficacy, whether the treatment works or not. Where this becomes an issue is not necessarily in cases where you know, you have a good partnership, you have a good team with the physical therapy good, you have a good team on the brace, the orthotist side. Then that system works. Where it starts to become this, the idea of judging whether a treatment works becomes problematic is when you don't have that relationship, and you're going to, I'm not going to pick on anybody, but like something like the Clear, where they do their x-rays at an outside institution, and the x-rays are done slightly differently, and they can present the data in a slightly different way. So when we do the x-rays, if you're part of the SRS, we do them in a very standardized way. They're reproducible, and they're done that way for a specific reason, because I want to be able to have the same conversation with me that I have with Dr. Pace, with Dr. Weinstein, and we want to be able to have the conversation under the same terms. And if x-rays are done differently, if techniques are done differently, that doesn't, it's not, you can't have that conversation that way. And then it creates confusion for you guys, because, you know, I give you one number, somebody else gives you another number, now you're going, well, who's right? Why is there a difference, right? That's really an important part of kind of thing. So you really have to have faith in your doctor. The doctor that you've gone to, you have to have faith in them that they're going to make the best decisions, help you make you the best decision for yourself, but guide you in the best way they possibly can. And don't forgo traditional treatment. If somebody comes up to you, and we've seen this today, right? Bracing works. The evidence is strong. There are adjuncts that are developing that may make it even work better. But if somebody comes up to you and sells you something that is completely off the wall different, I would doubt that. And at the same time, so I really kind of feel that it is important to have that conversation and use things as an adjunct, but we do have good evidence that the bracing works. Let's continue to kind of foster that, develop that other techniques to make it work better. And you know, I know bracing is hard, it sucks, it's miserable, but that's where my job is, you know, initially is to get you in the brace. Then my job is to be a cheerleader and kind of tell you of how well you're doing, how awesome you're doing, and working together to get you through what is a very difficult part of your life. And then remember our goals, right? This is one of my favorite patients because she drives me crazy. So she's got a bucket list, and the bucket list is quite long and scary. And so she's eventually going to be an ultra marathoner, but she did 2 marathons a week apart. So, and she's 5 or 6 years out from her treatment. So she's been doing really well. But we just don't need to be focused out on these things today, but we need to be focused on things in the future. So this is going to sound harsh, but I don't care if you're unhappy with the brace today or tomorrow, because the person I care about is the person you're going to be in 5 and 10 years. And so always, this idea of Dr. Asghar can be a little firm at times. Yeah, I can be. I really don't care. I mean, I do, but I don't care about how you are today, because in 5 and 10 years, if you turn around and say, Dr. Asghar was an awesome doctor, he cared about me and we did the right thing together, That's a win for me. So basically that's it. Thank you from our team. Any questions or concerns?